Welcome to the Frontier in Congenital Disorders of Glycosylation Consortium, the FCDGC. We're part of the National Institutes of Health's Rare Disease Clinical Research Network. Our team is dedicated to providing the best integrated clinical care for CDG, that's congenital disorders of glycosylation, so that from the patient's perspective, the services are consistent and coordinated. Our aim is to improve clinical symptoms as well as improve the quality of life and the life expectancy of individuals with CDG through advancing and sharing knowledge of CDG, developing and validating new diagnostic tools, and exploring therapeutic options to restore appropriate glycosylation. Glycosylation is the cellular process of creating and adding sugar blocks to proteins and lipids so that the organs of the body can function properly. Every cell in our body uses glycosylation, and that's why children with CDG can have so many health problems, including neurological problems, growth issues, gastrointestinal symptoms, such as throwing up or diarrhea, liver problems, heart problems, endocrine problems, and blood clotting problems. Depending on your child's unique needs, he or she may have several appointments with our team of medical specialists. And these can include a medical genetics specialist, a primary care pediatrician, neurologist, registered dietitians, endocrinologist, cardiologist, and even more. Your child's healthcare team works together to provide supportive care for your child and help him or her make the most of his or her abilities. And know that you and your child are the most important members of this team. To understand the causes of CDG, it can be helpful to understand some of the basic concepts about genes and heredity. Now, most people have 46 chromosomes in all their cells, and each chromosome is made up of a long chain of DNA. And a gene is a section of one of these DNA chains. Genes are like the instruction books that determine everything from your eye color to your blood type to your height, and especially how your cells work. CDG is caused by changes in genes. Healthcare providers used to call these things mutations, but now we call them pathogenic genetic variants because not every variant causes a disease. Most forms of CDG are inherited as autosomal recessive conditions. Now, recessive genetic disorders occur when an individual inherits pathogenic variants in the same gene for the same trait from each parent. If an individual receives one normal gene and one gene for the disease, the person will be a carrier for the disease, but usually will not show symptoms. These pathogenic genetic variants can be inherited from either the mother or the father, and in the case of CDG, the defective gene is inherited from both parents. Think of genes like words in a sentence that are spelled wrong or in the wrong order. They can keep cells from doing their work correctly, which can lead to genetic diseases like CDG. Unfortunately, children with CDG are often mistakenly diagnosed with other conditions, such as cerebral palsy or other neurological or genetic disorders, because their symptoms are so similar. An important part of the diagnosis is ruling out those other conditions. And for that reason, to diagnose CDG, your child's healthcare provider will talk to you about your family's medical history and do a thorough physical exam, which may include blood test, transferrin glycosylation test, liver ultrasounds, x-rays, MRI scans, and especially genetic tests, which are the most reliable way to diagnose CDG. Although there is currently no cure for CDG, there are many treatments and therapies available to help your child. The goal of these treatments is to treat the symptoms and the problems caused by the condition. This type of treatment is called supportive therapy, and it may include physical therapy, speech therapy, occupational therapy, or even a special diet. In fact, there are two types of CDG where a diet that includes a special sugar can help improve most of the symptoms. For the type called NPI CDG, mannose can help. For the type called PGM with CDG, galactose can help. Our specialists will define natural history, validate patient-reported outcome, and share knowledge on CDG. Develop and validate new biochemical diagnostic techniques and therapeutic biomarkers for clinical trials. And try to restore appropriate glycosylation in CDG to improve clinical symptoms and the quality of life in the patients and for their families. We're looking forward to providing you with the best care possible. So please let us know if you have any questions, and please do visit us online.